Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in. Today, we're going to get a little bit more into autoimmunity, and it's a little bit more detailed again. I'm going to talk a little bit more diagnosis, a little more in depth. Before I do, please scroll down. If you're on the YouTube channel there, scroll down and hit subscribe. And if you like what you see, press like. And if you think someone would benefit from hearing about this, share it. And as always, if you have a question or concern, or if you don't think we're communicating this clearly or it doesn't make sense, stop me. Don't stop me. Don't stop. You can't stop me now because you can't. I'm in my room with Justin right here. So but send me a question. Send me a comment. We really do read your comments, and that really do help us drive the content of this podcast. We want to be of service. I really do. I'm not here to sell something. I'm not here to prove something. I'm not here to do anything. I'm here to be of service. You know, this is a labor of love, as I always said. With that said, let's dive into the material. We've started off by talking about autoimmunity, why it's important to approach it. And the last episode, I really went into how hormones play a role in autoimmunity. And if you haven't watched it yet, please take a look at it. But still, I want to reiterate a couple things that were in there so that we have continuity and you guys are grabbing on what I'm saying here. It's this autoimmunity, as classic definition, is your immune system attacking yourself. As your immune system rolls through your body, it's looking at every cell, seeing who belongs, who doesn't belong. And for some reason or another, it's going to look at your thyroid and say, you don't belong. Or it's going to look at connective tissue and say, you don't belong. And to be more specific, you go after salivary glands and you go after joints. It's different things it goes after and says, you don't belong. And then it starts to attack that gland or that tissue. The classic concept is then all we need to do is modulate the immune system in a way that stops it from doing that. Shut it down. That's the classic approach. And the thing is that is not bad and it's not wrong. It's just not complete. As I mentioned in the previous episode, we need to understand why it was the immune system looked at the cells of self and said, you don't belong. What was it that triggered it to make the mistake? Why that's critical here is because by understanding that, you could further modulate disease progression and many times arrest its progression, many times reverse its progression. And you can have the patient go lose all their antibodies. And I have done that in clinic, and it's worked. It's worked. Because I think of it through that relationship. Not just, how can I shut down the immune system now because it's already potentiated? No, not enough. Mine is, how did it start? How can I stop that? How can I arrest that? How can I change and modulate the way the immune system sees self? And recognize self again. So previous episode, we talked about the role estrogen plays because women, you tend to have a higher rate of autoimmunity. And so it's easy to say, oh, it's because estrogen causes it. Not. It's the imbalance of estrogen. It's a lack of progesterone in balance with estrogen. And it's also the lack of androgens that we find in women, which would be testosterone, specifically free testosterone. So as the previous episode, we talked a little about those things. Today, I want to talk a little bit about the other one, and the monster in the room is cortisol. 80% of women who go on to develop autoimmunity will report a very stressful event prior to it. Very stressful event. The thing is stress and your adrenal complex plays such a huge role in immune modulation. It just is. And you can think of it like, you're under a lot of stress, it's easy to get sick. That's an old-fashioned thing, but it's true. It's true. As your immune system goes and flows across those cells of self, and it has that microclimate, as I mentioned before in the last episode, there's that microclimate. In that microclimate, there's going to be pro-inflammatory and there's going to be anti-inflammatory components at play here. And if you have an imbalance at that, that's when you start seeing those mistakes being made. So if your cortisol levels are low, which happens in chronic stress, you run that risk of developing autoimmunity. That's known. When you're under significant stress, this is a key thing, and I'm going to bring this up. There's a lab that I use in my practice called the neutrophil lymphocyte ratio. It's a common lab you use, and it was really okay. Let me say this: neutrophil and lymphocytes. Neutrophils is your bacterial immunity, lymphocytes your viral immunity, and there's a ratio you look at between the two of them. And the ratio is off. That's not good. That's inflammatory. That you can go on to having other conditions. And we know that when people get COVID, if the neutrophil lymphocyte ratio is off, they go on to having long COVID. But that's not just been that's not just been learned about. We've known this for a very long time. And it has to do with the fact that when you get sick, if your neutrophil lymphocyte ratio is off, it's a higher rate of you going on into chronic illness, chronic viral infections, and then chronic disease progression. And that ratio is very important. Now, what modulates that relationship, what modulates that ratio between neutrophils and lymphocytes, that's going to be your cortisol. If you have a patient who's been under chronic stress over time, their chances of a viral infection going chronic are much higher. Let me just put it this way: if you have a stressful life, you're running yourself hard all the time. Your body is running hard, and those people are that they work a lot of hours. They're burning the candle on both ends. Your reserves are diminished, and when I say reserves, that's going to be the energy reserves in your immune system, in your cells. And you see the cortisol levels being lower. And we know that as that becomes more and more diminished, these reactions become more pro-inflammatory. And you have the risk of going from being acutely sick in those situations, from burning the candle at both ends, to becoming chronically sick. So when I use that neutrophil lymphocyte ratio in my patients with autoimmune disease, and when I'm first working them up to understand them, and when I'm using that neutrophil lymphocyte ratio, that's just one component of it. I'm going to use that along with what their cortisol levels are. How high is their cortisol? How low is their cortisol? And then I'm going to use that understanding of that ratio and of that cortisol in order to further modulate their immune system, so that way their autoimmunity hopefully will go down. What does this look like in practice? That's a good question. When you run those labs and you have the person in front of you and you see that imbalance and you see their cortisol levels are low, what do you do? What do you do? Now, as a physician, most doctors that you see, the goal of the physician is to prescribe you something and then hopefully circle back and make sure it worked. A lot of times just prescribe, you just go off on your way. That's not going to work for us. When it comes to treating the adrenal gland, it is very tricky, because just prescribing you something doesn't really work. Hear me. If you have someone coming in here and they have an autoimmune condition that they brought on through chronic stress, say they have Sjogren's or mixed connective tissue disease, something along those lines, their immune system is attacking self, and you understand it as a function of their stress in their lives. Say they're working a lot of hours and they're not sleeping very much and they're not taking care of their own health. They're drinking a little bit too much alcohol. They're eating inappropriately. They're doing things to comfort themselves because they're working this hard and having very little downtime. Just prescribing them something for their Sjogren's and just prescribing them, if I'm going to be fancy, just prescribing them something for their adrenals, that's not going to stop this. It isn't until they understand that they can't live that lifestyle anymore. We need sleep. We need rest. We need to work, but the work needs to be meaningful and rewarding, and there needs to be recovery from work. So if we're treating someone who has autoimmune and we see that their stress is a player in that, I can't just prescribe, if they say they have very low cortisol, I can't just prescribe them hydrocortisone and send them out and tell them that'll help their autoimmunity. I mean, it will a little bit for a while, but that's not good enough. I need to sit down with them and understand their lives. Heart rate variability is one of the tools that I would use in these situations, and I want to talk about that just a little bit. When you have someone's autoimmune and they have cortisol as a big component, and I want to be a good doctor, which I always do every time, I'm going to talk to them how to use heart rate variability or any other tool like that to monitor how they are managing stress on a minute-to-minute basis. So we would have them come into practice and they would use like an Oura ring or a Garmin watch or any of those other wearables that you could, like the Whoop band. And you put those on, and what it's going to do is going to monitor how you're managing stress as a way of testing heart rate variability. And it's going to see whether you're entering states of stress. And when the patient brings that data back to me after a few weeks and they bring a diary of what they've been doing, I'm able to say to them, okay, this day, your stress were hitting these levels. What was happening? What were you doing? And if it's something that they cannot change, some of us cannot leave our work. I know that. Some of us cannot leave our family. I know that too. And some of us have these severe stressors that need to be part of our lives temporarily, hopefully. So then my question would be like, what can I do to help them reduce that stress? Again, just give them hydrocortisone is not enough. Then you have doctors say, well, just do breathing exercises. Well, how do you know if the breathing exercise worked? So again, someone presents to clinic with chronic stress. I have them monitoring their stress using heart rate variability, that they're using one of those Whoop bands or their ring or watch, whatever it is that's monitoring it. And then I'm saying, okay, I want you to go home and I want you to do circle breathing, which is when you inhale for 4 seconds, hold your breath for 4 seconds, exhale for 4 seconds, hold your breath for 4 seconds. It's called, or you look up box breathing online. Works well for some people. When they do that box breathing, you want to have them do that for about 5 minutes. And they want to see, did it improve their heart rate variability? Did it reduce stress? If it worked, then you're going to tell them this is what you're going to do. Whenever you see that stress levels go up on your wearable, whenever you're into those stressful situations, either immediately after or around that time, the best you can, try and do that circle breathing. Try and improve that way. Other people, what about ice plunges, cold plunges? That can work. You want to have them do a cold plunge. Did it improve their heart rate variability? If it did, then you want to tell them use that tool. When they have had stressful days, that's when you want to be doing your cold plunges. Vagal stimulation, where you massage the vagus nerve, that can help too. Cold packs the vagus nerve. That's another thing you can do. So our goal with these women is not just to prescribe, but is to also help give them tools that they use in their day-to-day lives to modulate the way that they're responding to stress the best we can. And again, some of them can be deep breathing, some of them can be cold plunges, some of them can be certain types of vagal massages. They could be meditations, it could be spending time reading a book, whatever it is. You want to talk to them. What is it that you can do in your personal life that you would like to do that will reduce stress? And then verify it worked. How you'll know this is effective, you monitor their autoimmunity at the same time. What are their antibodies doing? Did their antibodies improve? If you can have someone doing that box breathing, reducing their stress, improving heart rate variability, and you could show that it improved their antibodies, you are doing your best work as a physician. I hope this helps. Please comment. Let me know what you need more from us on this, because this is an important topic. And I know this is a real abstract thing I just went into, but these are things I think that could be very helpful for you with autoimmunity. Next episode, we're going to get a little bit more into how we treat for this and the different therapeutics we will use. And after that, we'll do maybe a Q&A and answering a few of the questions you've had over the course of the series. And as always, please share, like, and subscribe. And then I'll see you at the next episode.